All right. So spine degenerative diseases are classified into a slip disc, which we commonly say. And actually, what is slip disc is an intervertebral disc prolapse. And the other common degenerative diseases are degenerative orthopathies like spondylitis and sometimes a break in the pars plana, which is called as spondylolisthesis. So basically, we tackle with these things, and among these, the more prevalent is slip disc, that is intervertebral disc prolapse. So what do we understand by intervertebral disc prolapse? So it is the disc which is actually meant to support the bones that will be prolapsed and that will be hitching your spinal cord and the nerve roots, which causes pain, spasm, and the radiculopathy. Radiculopathy means the pain radiating from the lower back to our leg, thigh, and the feet. Commonly, we understand these many terminologies as simple slip disc. What's the cause of slip disc? So cause of slip disc is our lifestyle. So sedentary lifestyle actually makes us more prone to get slip disc. So what's actually happens here? So in a sedentary lifestyle, what happens is because of more of urbanization, more of desk job is created. So because of the desk job, we try to sit in the long time in the wrong posture. So that makes our spine slowly degenerate. Means the disc between the bones will be degenerated because of awkward posture of sitting for long. So because of this one, the normal integrity or the normal consistency of the disc will be lost. So when we tell about the disc is nothing but a soft tissue which lies between the two bones in our spine. So starting from the neck to our lower back. So the disc which is between the bones will actually act like a shock absorber, and the anatomy of the disc is like a gel wall. The gel wall which is covered by the fibrous layer called as annular fibrosis, and inside the gelatinous material is called as nucleus pulposus. So when the gel wall integrity is good, the health is good, it will take the shock, it will absorb the shock, and it will rebound back to normal. When we are sitting for a long time in an awkward posture, what happens? There will be a constant pressure on the disc which makes the disc to lose its water. The nucleus pulposus will be devoid of water and it will be dehydrated, and the annular fibrosis will remain in place. Now the normal consistency and integrity of the disc is gone. So the disc is more like a rubbery tissue or like a dough, something like that. So it will not take the shock, it will not absorb the shock. Instead, it will get bulged because of the activities which makes us bend forward, take the weight, or sudden jerky movements when we are traveling. So here it will classify into two things. So one is a disc degenerative condition, which is because of our lifestyle. Second, a disc prolapse, which is because of the event, what we are doing in our daily activities. The degenerative process is a prolonged one because of inactivity, lack of exercise, no proper diet, and sitting in an awkward posture for the longer time. When the disc is dehydrated, when we tend to do some activities which we were doing very nicely, when the disc was nice, like jumping, dancing, bending forward, taking the weight, pushing. So all those activities were good when the disc was good. When the disc is degenerated, the shock will be not properly taken. So the damaged disc, especially in the lower back and in the C-spine, that is our neck, the disc will be slowly compressed, or it may burst open with certain strenuous activities, high intensity activities. So what will happen? There are the two things here. The slip disc is a common term. So slip disc is nothing but a bulge of the disc, posteriorly, that is behind. Behind what we have a very beautiful spinal cord and the nerves which is coming out of the spinal cord, which supplies our upper limbs and the lower limbs. So the disc which is pressed, compressed and bulged, that will be compressing the spinal cord and the nerve roots. What happens here? The pain starts, the spasm activates. Both are the compensatory mechanism in order to prevent the further damage of the disc and in order to prevent further damage of the spinal cord and the nerve per se. So this is the first symptom what everyone gets routinely. So doctor, I have back pain. So I did some activities yesterday. I bent forward, I took some weights. I went for a travel, I went for a hike. I started getting back. Then why? You're not supposed to get that. You're too young for that. So now what I'm getting a 20-25 young chap who are getting with a huge disc bulges, a huge slip disc. So the basic thing here is we are not properly maintaining the disc. And we are doing the activities which are not supposed to be done. So the disc is getting damaged. Okay, so because of these things, more of morbidity is occurring nowadays, mainly in IT industries, because they tend to sit for the longer time. Okay, the second reason is lack of exercises. So lack of exercises means lack of strength of the lower back muscle, that is the paraspinal muscles, which are lying just behind our spine and the neck. So these muscles will support in taking the load, and when they are weaker, they will not take the load. So two things. So weak muscles and a degenerated disc makes any person prone for a slip disc or intervertebral disc collapse. So we have two things in intervertebral disc collapse. Either it is a bulge or it's an annular tear and prolapse of all the sequestrated disc outside the spinal canal. So because of this one, we get certain complaints like only back pain or radiculopathy, or sometimes in the worst conditions we get weakening of the leg muscles and foot muscles, as well as sometimes quad venous syndrome. So the severe cases we tend to manage surgically by decompressing and as well as the discectomy and laminectomy, what we usually perform. In the milder to moderate cases, we cannot leave. So there's a case where we have to tackle very nicely. So basic treatment starts with the rest. We want the patient to be resting for at least 2 to 3 weeks. Then we'll be introducing some pain medications which are judiciously used. Then we'll start with our therapies. So therapy will make pain to come down, increase the mobility. This is not sufficient. Then we go for, now I told it is compressed, because of that one the disc is bulging out and it is compressing the spinal cord. So we have to eliminate that compressive force by giving a decompression force. So there are so many advanced technologies in spine decompression as well. We start from manual decompression therapies to a robotic decompression therapy, which is more precise nowadays. And with that help, so the decompression is achieved very fast. When the decompression is achieved, then we have to regenerate the disc cells to normal. Earlier it was not happening because the disc is the last structure in our body to get nutrition, because it has to depend on the end plates of our upper and the lower bones. So it doesn't have direct blood supply. Because of that one, the nutrition will be not carried to the disc. The NMR plays a very vital role when we are treating a slip disc. So what it does, actually it activates the end plates, it activates the chondrocytes and fibroblasts which are there around the disc and around the end plates of the bone. When we achieve that spine decompression, of course, because of the decompression force, the nerve which is being compressed is relieved from the massive compression, and the radicular pain will be gone. Though the pain may complain of some of spinal pain or the back pain, but clinically there will be a drastic change in his gait, that is walking, and as well as the pain which is radiating to his thigh and feet will be gone. So when the decompression is done, then we'll be shooting him, we'll be giving him a nuclear magnetic resonance therapy, where we'll make him lie down in the machine for an hour for 9 days. So that will make the fibroblasts and the chondrocytes to get stimulated, that is to take the energy and to start regenerating by itself. Okay, because of this one, the decompressed disc will try to take the nutrition from the surrounding bone and the surrounding structure, so the rehydration will start occurring back to normal. So the disc which was dehydrated, it will be rehydrated within few months, and it will be in a good state. Even the bulge which is there, or which is a sequestrated disc which is falling, that will be eaten away by the macrophages. The spinal cord and the nerves will be freed. That was what we were doing before, was we are manually opening the spine and we are trying to take the bulge disc and the sequestrated disc, so that the spinal cord and the nerve should have been very freed up. With the introduction of nuclear magnetic resonance therapy, the regeneration of disc is occurring in one way. The macrophages which are present, even they will be activated. The remodeling of the prolapsed disc will also occur in one part. The third part, the pain will start deteriorating, that is coming down from day 5, day 6. At the end of 2 to 3 weeks, the patient will be completely fine and devoid of all kind of pain and radiculopathy. And when we try to visualize after 1 or 2 years with them taking an MRI, the disc will be in a better way actually. So that we have already proved, and we have so many published data on that one. So with this intervention, the nuclear magnetic resonance therapy, the slip disc is being treated very, very nicely, and most of the patients who have taken the treatment, they are doing very nice. So this makes and this boosts my confidence to practice more and more regarding regeneration rather than a surgical part. If I do surgery, what happens if I try to give the NMR post 3 weeks of surgery, so that it will augment my surgery and the healing process will be faster. And basically every surgeon will want our patient to back to his normal feet and start doing his activity and enjoy his life. After all, we have only one life, so that why we should be suffering with the pain for the longer time.